Hi, I'm Emily Friedman, and I'm here today talking with Jina Suh, who is a research assistant on one of the projects that ALACRITY is funding. We are here to talk about a visual collaboration tool, specifically Miro. It's the one that she used with her team. Their project is looking at how to better support patients who are dealing with both cancer and depression at the same time. And Miro, or any visual collaboration tool, is a really valuable tool because it is very flexible and it can be used remotely with a team, so everybody can be working on the same document at the same time. Gina's going to take us through 3 different ways she and her team use the project to synthesize the data that they collect in the discovery phase. What's great about the Miro tool is that it's super flexible and can be used, as you can see here, there are many different templates, and it can be used in various different forms. So here's an example of using this visual collaboration tool to Affinity Diagram data that they collected through interviews. Gina, what are we looking at here?
So here we have a bunch of themes and technology solutions that we've identified, and as part of the Affinity Diagram process, we group them into different topics. So here we have a collection of PROs and other different topics, but then we've also further spread out the data into technology solutions and the perspectives from the clinicians we're collaborating with and the participants that were in our study. Okay, so we began by interviewing a bunch of patients and providers, and we transcribed the interview recordings, and then we dumped the transcribed data into a qualitative coding tool called Atlas TI. And within Atlas TI, we coded different parts of the transcripts into emerged themes, and we dumped those themes, including some of the representative quotes, into an Excel spreadsheet here. And what we ended up doing was to have the psychologists and psychiatrists that we're collaborating with provide clinical comments to the quotes and themes that we've identified, and then we wanted to further kind of group them into different technology solutions. So what you can do here is, once you have a tabular structure of data, what I'm going to do is just kind of copy a whole section of the Excel spreadsheet and dump it into Miro board, just copy and paste. And what Miro is going to do is create sticky notes that you can just kind of move around and put into a visual, groupings.
So each cell from Excel has become its own sticky note that you can then organize as you see fit.
Right. And what you can also do is, different columns could be different colors. So for example, if I paste this here and I can turn it into green to indicate that this is coming from a different column, and those kinds of things.
Oh, that's great.
That's how we were able to create this kind of visual board.
So can you zoom in a little so we can see what some of these things say? What does purple represent?
So purple represents a technology solution that we've identified. So for example, patients can complete their assessment on their own using mobile or web platforms, which was a gap that we've identified. And we have, for similar things, a clinician commenting that assessment is very important, but only part of the assessment is important. And then we have participants stating that sometimes patient hides depression, which is why assessment is important, or sometimes assessment is incomplete because it doesn't actually capture the full social context.
What does PROs mean in this situation?
PROs are patient-reported outcomes.
Got it, okay. So here's an example of where Gina and her team used a different Miro board template to do an activity that is typically referred to as the 5 whys. In this situation, people repeatedly ask the question why to dig deeper into a problem and to understand its source. Sometimes it takes 5, sometimes it takes more whys, sometimes it takes fewer. So Gina, why don't you walk us through what we're looking at?
Right, so the problem that we were trying to dig into was the fact that patients are falling through the cracks. So the patients that were supposed to getting depression care weren't actually following through. So in this template, what you can do is just kind of click on the plus, and it creates a kind of a sub leaf node, so to speak, on a tree, and you can kind of start to dictate why you think that problem is occurring, and start to dig deeper. So, for example, patients cannot schedule an appointment. So why is that? And keep
Right.
down the line.
And so why? What? Because the care manager, psychiatrist, and psychology schedule is booked or full. Why is it full? And so then here, there's more demand than resources available, or patients are holding on to resources without being evaluated for progress or need. So this is just a visual tool to help be able to see the progression of all of these.
Mm-hmm.
And so looking at all these different reasons why patients are falling through the cracks. It's just a great visual tool to make sure you haven't missed anything.
Right. And ultimately, you can export this, and then if you wanted to further affinity diagram, you could do that.
So in this third example, Jina and her team used Miro to map out the communication flow. Why don't you walk us through this complicated diagram?
So there are many players in our project, players in the problem space. So there's patients, there are caregivers, oncologists, and psychiatrists, many different people. And we wanted to understand the breakdowns in the communication, which means we first need to map out what are the communication points. So we noticed in our observation that there are emails being used, EHR, face-to-face communication that's happening, or phone conversations that are happening. And we were interested in understanding how the patients get referred to the mental health providers to begin with. And so we identified, okay, oncologists have face-to-face interactions with the patients, and they can maybe indirectly or directly patients can demonstrate distress indirectly, perhaps, or front desk staff could administer a screening to assess their depression. And once that happens, they get referred to the mental health providers, who are general oncology social workers. They may be face-to-face taking care of navigational issues like financial aid and housing, or they could be getting the screening results from the front desk staff when the patient checked in, and looking at that issue and those other things. And social workers are also working with the psychiatrist. So how are they actually communicating? They're communicating referrals to them, or through other tools that they use, which are EHR systems such as Orca or patient registry.
I see you have some lightning bolts here. I assume that indicates a big problem.
Yeah, those are potential barriers or communication breakdowns that we've started to identify.
So one limitation of using the free version of Miro is that you're limited to only 3 boards for collaboration. And so one workaround that they discovered was creating mini boards within a larger board. This is useful for not only avoiding getting a paid version as long as possible, but also being able to have multiple versions of the same document as you learn more and maybe figure out a better way to visualize it. Mm-hmm. What other challenges did you experience when you were using Miro?
I think there are definitely browser differences in terms of the UI. The UI could be finicky if multiple people are working on it. We've had issues importing and exporting data. Obviously, it's not always streamlined. If you're doing something simple like dumping, copying and pasting a bunch of stickies, it's straightforward. But if you wanted to export the data in a grouped way out, it's definitely challenging, and it's something that I haven't been able to figure out.
Okay. Overall, would you recommend this tool?
Right. I think it's a great iteration tool if you just have some ideas that you want to explore. It's definitely not a high fidelity, something that is publication or publishable worthy material, but it's definitely good for collaborating with other people, just kind of thinking out loud, brainstorming.
Great, well, thank you.